Okay, guys, I think we'll get started here. Thank you so much for joining us here today at WoundCon Spring. My name is Caoimhe Kenny, and I'm the Director of Marketing for the American Board of Wound Management. And I'm delighted to welcome you to our session, Why Board Certification is Important for Wound Care Providers. I'm joined today by three of our esteemed ABWM board members, Dr. Karen Wientjes, Dr. Ed Mahoney, and Chris Murphy. So these board members will be chatting to you today about the benefits of wound care certification for both providers and for patients. Board members, if you'd like to quickly introduce yourselves.
Sure, I'll start. My name is Karen Wientjes. I am a physical therapist and I'm the current president of the American Board of Wound Management. And I'm from the Pennsylvania area, just outside of Philadelphia. So welcome.
Everyone, I'm Ed Mahoney. I'd say I've been a certified wound specialist for about 16 years now. My day job is I'm the program director for the physical therapy program at LSU Health in Shreveport, Louisiana. And I'm the exam committee chair for the ABWM.
Hi, everybody. I'm Chris Murphy, executive director of ABWM. I've been with ABWM for just about as many years as Ed's been certified, and looking forward to working with everyone this afternoon.
Thanks, everyone. So in terms of the format for today's session, we'll spend the first 15 to 20 minutes on our main topic, and then we can spend the rest of the session answering audience questions. So feel free to pop any questions for our board members in the chat box, and we'll hopefully have time to answer them all towards the end of the session. And just to note, this session is being recorded and will be available in the ABWM virtual booth for the next 7 days as part of the on-demand portion of the conference. Okay, so let's get started. So board members, could you give us a little bit of background on the American Board of Wound Management and why it was set up?
Sure, Caoimhe, I'll take that. The ABWM, or AAWM as it was originally founded in 1995, was founded in South Florida by 3 podiatrists that recognized the need for wound care in the community. The CWS was the initial certification exam, which they had developed by late 1996 and started issuing the first CWS exams and written exams in 1997. And then in late 2008 and 10, we added the CWCA for non-bachelor degree candidates and the certified wound specialist for physicians.
Awesome, great. So what are some of the main reasons that wound care providers should think about getting certified?
Okay, I'll take that one. I think, this is one of the most recognized wound certification credentials that's out there right now. And I think one of the strengths is really the multidisciplinary certification that you have. So you're part of a network of professionals that have all demonstrated this elevated level of competency in the field. And I think that sets this exam apart from some of the others that are out there in this credential.
Great, thank you. So then from an employer's perspective, what do you think is the advantage of having a certified wound care specialist as part of your team?
And I can take that one as department head. I think one of the major benefits is it's just instant validation. I can call another physician, a nurse, a PT, whatever in the area, and once they see CWS, they know that I'm held to that same level of standard that they are as the CWCA or CWS or CWSP. So it almost gives us that level of trust between each other that if they say something, I'm more inclined to take them at their word and vice versa. And it just opens the door, I think, for ultimately doing what's best for the patient, which is the only reason we're doing this.
Yeah, and that segues nicely into my next question, actually, which was that, from a patient's perspective, like why would they seek out a certified wound care specialist when receiving treatment? What's the advantage of that?
I think the biggest advantage is really just to have that trust in their provider, that they've demonstrated a minimal level of competency. And, you know, I actually believe it's a really rigorous exam, and they're getting a really high level of expertise in their provider. I think that's really the biggest benefit, is that they know that they can go to this, actually even on our website, just this portal, and find the closest provider to them that is certified through the ABWM.
Yeah, absolutely. And I can pop a link to that Find a Specialist directory into the chat as well, if anyone's interested after the session to go over and have a look, and you can see which what certified wound specialists are in your area.
If I could just add to that, you know, I'm sure all the attendees would agree with this too, is people don't necessarily know the wound care even exists until they need it. You know, it's not like I need a dentist and I have a general idea. I know exactly what a dentist does, and it's a matter of where do I go. So getting that out there to people and making them understand that just because somebody says they're doing wound care, there is a standard that they should be doing. I think this is a simple way for patients to understand, like, oh, they have this credential that means something.
Yeah, definitely. Thanks, Ed. So we have 3 certification exams. There's the CWCA, the CWS, and the CWSP. The CWCA, the Certified Wound Care Associate exam, is open to sales and marketing professionals in addition to healthcare providers. So what is the benefit of wound care certification for those individuals?
I think, you know, we saw a real need that there are individuals that are in marketing and sales positions interacting with a lot of wound care providers, and do end up learning a lot about the field. And there's a benefit to them to have this credential, so that they actually can kind of rest on that a little bit and know that they have this experience and this expertise in the area as they're going out and doing marketing, interacting with other healthcare professionals. I think it gives them a little bit more credibility when they're in different facilities.
Yeah, that makes sense. So we have a question here that from one of the audience members that is the same as the next question I had on my list anyway. So what differentiates ABWM from other organizations that provide wound care certification? What sets us apart from other certification bodies?
I'll let Chris answer a lot of this, but I think first, just to start with just the format, so people are aware of that, is you would sit for the exam and then you have a 10-year recertification, just starting really basic in case somebody didn't know how our format was. We don't have a course per se that you would take. You know, you can take whatever prep course you would like, or study on your own, or you know, whatever method works best for you as an individual. So there's not like you must take X, Y, and Z steps and then take our exam. We do have a foundation that can help guide people towards those things, but we really try to keep everything separate because we are trying to make it as honest as possible, basically, so that you're truly taking a test that measures your knowledge and not just what you could remember from yesterday, like your true integrated knowledge, if you will. But Chris, I don't know if you want to go into that a little bit more.
Yeah, one thing also is that we're the original multi-discipline certification. So we were the first. We're a nonprofit. We've been around for almost 20 years now. But the other thing I think that differentiates us is our accreditation with the NCCA, the National Commission of Certifying Agency, and that's not the ABWM, that's each program. So the Certified Wound Care Associate, the Certified Wound Specialist, Certified Wound Specialist Physician, all accredited. And that means that we have demonstrated that we meet all the psychometric benchmarks for administering a national board certification exam. So all of our exams, they're just not questions that are submitted. Each question is reviewed by a team of subject matter experts at least 3 times, and then they're all pre-tested on an exam before they actually go live to other real-time exams.
Great.
Anything you wanted to add to that?
Oh, that's great. I mean, I think that it really is a big difference that we have with some of the other exams.
And I know this is going to lead into another one of previous questions, but relating to the exam committee and the subject matter experts, to be on the committee, you must possess one of the three credentials. So it's CWCAs are writing the exam for the CWCAs, and CWSs for the CWS, et cetera. And we're looking at a very wide, diverse group. So we're not trying to make sure it's not all the same people from the same region of the country with the same profession writing the exam, so we can understand, the PT brings up something and the nurse says, well, no, we would think of it differently, and the physician a third way. So it really is, I think Karen would probably agree with my statement, that one of the most rewarding professional organizations I've been a part of. This is the learning environment that you get with the other people through the exam committee. Is such a cool approach, I think, that multidisciplinary approach really put into action.
Yeah, and that's definitely how I even first got involved with the ABWM. I was certified way back about 20 years ago, but over the years I started working with the exam writing and the exam committees, and that was really a great opportunity for me to see all the different viewpoints that kind of come in to building that exam, which is so reflective of our environment that we practice in. It's not just a silo of just PT or just physician or just a nurse. We really do want to have that well-rounded perspective for this exam, because that's the way we practice in real life.
Yeah, that's a great point. Just to take a step back a little bit, there may be people here with us today who aren't totally familiar with, who we are and the three certifications that we have. So if we could delve a little deeper maybe into, what the eligibility requirements are for each of our certification exams and who they're open to, that would be great.
Sure, I can take that one. The first is the Certified Wound Care Associate. And as we previously said, that's open to sales and marketing, and anyone without a bachelor's degree. So associate level degree, high school diploma. And that's typically LPNs, CNAs, PTAs. The next is our Certified Wound Specialist, multidisciplinary. So PTs, RNs, doctors, podiatrists, anyone with a bachelor's degree in a health science. And then the next one is our Certified Wound Specialist Physician for MDs, DOs, and DPMs. Each requires 3 years of wound care experience. Doesn't have to be full-time wound care experience, and it doesn't need to be the most recent 3 years. They just have to be able to document 3 years, over their professional career. The exams are available 24/7 at our new testing centers, Pearson View, and should be very easy for people to register and get tested within about a month.
That's great. And actually, just we have a question here that's sort of relevant to that I'll take now. That it's the person asked, what is the main difference between CWS versus CWSP for physicians? Why would they take one versus the other?
I'll start trying to answer that. So there is a subset that's similar. The anatomy doesn't change, obviously. But what ends up happening with the physician exam is it goes a little bit more into the synthesis of data, I would say. So where, just to give you an example of something, like the question might end up where the answer on the CWS is patient needs antibiotics. The physician exam may take it to that next level, and it's, do they need antibiotic A, B, C, or D? So it's that advanced diagnostic. It's a little bit different than the non-prescribing providers that would take the CWS. But again, a lot of it is the same. Anatomy is important for the nurse, the PT, the physician, anybody doing wound care. So the content outlines it a little bit, but I think that's the big difference.
And I do want to mention too that we do have some podiatrists and DOs that will still take the CWS exam. They're open to take either of the exams if they would like to.
Yeah, that's a good point. Thank you. So to go back to, one question that we've gotten a lot today in the WoundCon booth, WoundCon seems to have a high proportion of international attendees. And so we've gotten the question if people outside of the US can sit for our certification exams.
Yes, so our exams are predominantly, most of our diplomats are predominantly from the US, but we have administered exams internationally now. I do think that there is recognition that's happening internationally with it. The exam is given in English, and it would be based on US standards of care, but it can certainly be administered to international attendees.
Great, thank you. I know there were some people in the booth today who were very happy to hear that. Great. So in terms of then, like, if people, have decided that they want to sit for their certification exam, they've applied, they've been approved. At that point, then, are there resources available for candidates to help them study for the exam, or what would you recommend?
Sure, I can take that one for you. But as ABWM being a certifying body, we don't endorse or have any kind of prerequisites for the exams other than your experience and your education. We do have an educational foundation, the ABWM Foundation, completely separate organization, but they do offer study materials that will assist you in preparing for the exam. But again, they're not required. And people can prepare however they see fit. But the foundation offers practice exams, flashcards, study guides, and in-person courses for people non-COVID that are interested in preparing for the exam.
Great, thank you, Chris.
Can we take that website in the foundation website?
The foundation, yeah. You can definitely put that in the chat. And I know if you go to our booth, that there's under the certification resources tab, there's some links out to the ABWM Foundation as well, where you can access those study guides and flashcards. I'm just gonna type that link in the chat. Great. So once a candidate then has passed the exam, are there annual renewal requirements, and is there continuing education required?
Sure. So the initial certification is good for 10 years. So at the 10-year mark, all candidates will have to recertify again by exam. And in the meantime, there's an annual fee of $150 and 6 hours of documented continuing ed each year.
Great, perfect. And then what about recertification? How often do people need to do that?
Recertification is every 10 years. So on the 10-year anniversary of your certification, you can take the exam. If you're certified as a CWS and you're a physician and you want to recertify as a CWSP, you're free to do that. You also don't have to wait 10 years. If you find that at year 8.5, it might be the best time for you to have some free time and prepare. You're certainly able to take it early, and then the 10-year clock for your next recert will just start at that time.
Great, thanks, Chris. Another question that we get asked is once people are certified, are there other ways that we can that they can get involved with the organization? And I feel like we touched on this earlier with the exam committee, but are there other volunteer opportunities with the ABWM?
Sure.
Well, go ahead, Karen.
I was going to say, I think there are a lot of different opportunities that might suit different people. So one of the ways is exam writing and being a part of the exam committee. So certainly if that's an interest, you could submit an application to us and let us know that you have an interest in that area, and we can look at that. Another area is that we're always looking for ambassadors for the ABWM, and this is a relatively new program that we started, but really looking for folks that are credentialed and are in the field and can kind of give us sort of the pulse of what's going on and what they're experiencing, and how can we best help them market themselves to their institutions, or let patients know that, you know, the difference between a certified provider and one that maybe isn't, but just has experience in wound care. So those ambassadors have been really a grassroots way of us to kind of find out across the country what the wound care needs are and what certification, how it matters to different aspects in different communities.
That's great. Thank you, Karen. Okay, well, I think that covers off all our pre-prepared questions and answers. So I'd like to open it up to the audience a little bit more. We have a couple of questions lined up here in the chat, but I would encourage anyone, if they have any questions based off anything we've discussed here already today, or anything else they'd like to know about ABWM or wound care certification in general, please just either pop it in the chat, or you can use the Q&A function in the Zoom menu bar to ask a question. So the first question we have here is, why is CWSP only for physicians when NPs can also prescribe? So if anyone would like to take that.
Erin, you want to take that one?
Yeah, you want me to take that one? So the CWS was our original exam that we offered, original credential. The CWSP is a certified wound specialist physician. So since it is a physician, then that's really why it was aimed more towards MDs, DOs, or podiatrists. That said, the only difference, I know Ed gave an example of a prescription for antibiotics, but that really isn't the only thing that sets it apart. There are some decision-making and surgical questions and things that kind of pertain more to that specialty. So in that sense, we feel that the best fit for the nurse practitioner would be with the CWS, just still, again, probably the most widely recognized of all of the credentials.
Yep, great. Thank you, Karen. Oh, I think another one just came through there. So Manda Hobbs asks, while traditionally a PT-driven program, can OTs and OTAs also sit for the CWS?
OTs could sit for the CWS. OTAs could sit for the CWCA, unless they had a bachelor's degree in something and, you know, happened to just be an OTA, but still met all the other criteria for the CWS. But yes, absolutely, they could.
And I just to comment on, I don't know that we have a lot of PTs certified with us as part of the CWS, but that's just one of a range of many specialties. And we have a lot of registered nurses who have that certification, nurse practitioners, physician assistants. So there's like a really broad range of specialties that kind of sit under that CWS umbrella, which is really the multidisciplinary aspect of our certifications. Okay. Just seeing. Don't see any new questions popping up here. Just while we wait, in case anybody is typing, board members, is there anything else you'd like to mention about ABWM or any other comments for our attendees?
The one thing that I would just want to remind everybody, if they are thinking about taking the exam and getting certified, we highly encourage you to do that. One thing to remember as you're doing that is some of our exam centers are operating at 50% or 25% capacity. So try to plan out and give yourself as much time as possible to schedule that. Ideally, you know, under normal circumstances, we should be able to get something scheduled within a week or so, but due to closures and backlogs and the limited capacity, some of our testing centers are scheduling 6 to 8 weeks out. So you want to give yourself plenty of time, as much time as possible to try to schedule your exact time.
Yeah, that's a really good point. And again, even the person that's, doing wound care, 5 days a week, I would still encourage you to take the time to really go over and study your materials before you sit for the exam. There are the resources, as we pointed out, on the foundation website with the study guide and flashcards, and even the wound. There's a course that we would recommend, that might be beneficial as just a way to review and kind of prepare yourself for the exam.
One other thing people might not be aware of that's a little different than some other certifications you may have is you'll get your results when you finish your exam. It's not, you don't have to wait 3 months or whatever it is as you do for some types of certifications.
Yeah. And I think the other benefit of this particular credential is the network of other providers that you're really, certified alongside with. I think that really is a strength. And when you look at all of the different professionals that are certified through us, there's really a nice collegial aspect that's there. We see each other very often at meetings. Well, hopefully we'll see each other in person soon at these meetings. It is really nice, a recognizable credential that you can really feel really good about. You should be proud of.
Absolutely. Okay, well, I think that's all we have time for here today. Thank you all so much for coming to our session and for all of your wonderful questions. And thank you to our ABWM board members for participating. I think this has been really informative, and just as a reminder, the session has been recorded and it will be available on demand in the booth over the course of the next week during the on-demand portion of WoundCon. So if you'd like to refer back to any of the questions, you can easily do so. As a next step, if you're, feeling very motivated to apply after this session, I'd recommend checking out the application section of our booth, where you can download the candidate handbooks and exam applications for each of our 3 exams. And also, please don't forget to follow us on social media, and you can subscribe to our newsletter directly from the booth as well, where you'll get all the most up-to-date information on ABWM wound certification. So thank you and enjoy the rest of the conference.
Thanks, everyone.
Thank you.
Thank you.
Aaron,